get started, shall we? So to everybody who is in the room already, kia ora. You might have seen me before. For those who do know me or don't know me, I am Alex Kabel-Chantren. I am Medtech's Integrations Program Manager. Today we have with us Anthony Lee, Daniel Wheeler, Eugene Chu, and Fida Ali from Houston Productivity Solutions. Houston is a long-standing partner of Medtech's whose products integrate with Evolution via our interoperability platform, Alex. We are also very lucky to have with us today Dr. Richard Medlicott from Island Bay Medical Center. So I know many of you will already know him. So we're very excited to hear from him today. The Houston team today will be showcasing a number of products. So I'm sure there are going to be lots and lots of questions and some great feedback coming up throughout. So as these crop up in your mind, please do feel free to pop those into the Q&A box down the bottom of your screen, and the team will aim to get through as many of those as possible before the end of the session today. That said, if your question doesn't get answered directly in the webinar, we will ensure we get all of the contact and question details sent through to the Houston team after the webinar, just to make sure that those are followed up. So it will make sure that no matter what, you have any of your answers, any of your questions answered. There we go. So also for any of you who have any colleagues or associates who are really interested in attending today, but for any reason could not make it, given the busyness of primary care, we are indeed recording this session. So we are, of course, happy to pass that along to anyone interested. We will pop up contact details at the end of the session. So if you haven't already requested the recording directly, you can certainly request it at any time, and we're happy to pass that along. So we're not here to listen to me jabber on, so I'll pass on to Fida.
Cool, thank you, Alex. Sweet, so I will just briefly go over today's agenda. So introductions, Alex has nicely introduced our team today. So then after that, we'll go over QuickShot, which is one of the main reasons we are here, and then provide like an interactive demo, and then we'll get some words from Dr. Medlicott as well. And then after that, we'll show you guys our new product, which is analytics, and we'll do another live demo for that. And then we'll have like a Q&A session. Like Alex said, pop anything in the chat and we're happy to answer those for you guys as well. Cool. So let's jump into the first slide. What is Intellimed? So Intellimed is actually a suite of smart automation tools. We're actually designed to make your life easier for medical clinics. So essentially, we're not here to replace your admin team or your PMS system. We're here to work alongside with you guys. So you can sort of think of Intellimed as sort of like a helpful new coworker that sort of takes care of the repetitive stuff, things like admin tasks, data entry, and reporting, so your team has more time to focus on what actually matters, is caring for your patients. So with Intellimed, your clinic can save time by automating routine admin work, reducing manual errors, and getting real-time insights through our modules like analytics, and creating a smoother and faster experience as well for your patients. Moving into QuickShot. QuickShot is one of our Intellimed modules. It's designed to make clinical photography really simple and secure as well. We have many clinics whose doctors use QuickShot on a daily basis to capture patient photos, which this then does integrate directly into Medtech. So all our patient photos are stored safely within the patient management system. That means Intellimed does not store or keep any of your data. So that's completely private to you and your clinic as well. QuickShot is actually really simple and super easy to use. It only takes 4 steps. So first step, you're entering your patient NHI, so that when you upload each photo, that it's linked to the correct patient record as well. So you go ahead and take the photo that is relative to your patient, add a short description, or you can sort of autofill the description box with the date and time as well, and then hit submit, and that's it. It's that easy as well. So a few of our QuickShot benefits is that it's been a real time saver for many of our clinics, being able to sort of capture patient photos and upload it with one click. This sort of takes away the hassle of manually uploading it, which means it gives doctors a bit more time to focus on their patients as well. To make things easier, we always make sure we have consistent documentation for all of our records. So that means every photo is labeled and uploaded the same way, which means your records stay organized and high quality every single time. Most importantly, QuickShot handles all photos securely and in line with health data standards too. So that means your clinic stays fully compliant while keeping your patient data very safe. That's the wrong slide, sorry. Just to show you how great QuickShot really is, we do have Dr. Richard Medlicott, which is the director and GP at Island Bay Medical. Fun fact, he and his team have been using QuickShot since November 2023 and have already completed over 2,000 submissions. So I'll hand it over to you, Richard, and you can sort of share your experience using QuickShot.
Sure. Yeah. We've got a camera that sits in the sluice room where we've got a lot of our equipment, like the liquid nitrogen and a little ECG app and all that kind of stuff. And it really is invaluable and pretty simple to use. And in this day and age, we should certainly be well past the time where we take a photo on our phone and then upload it via our personal cloud and so on and so forth. There's lots of slightly shonky ways that you can share pictures. Yeah, I guess what I like about it, I like the simplicity. So as Fida says, it is you can just open up the app, into the NHI, it finds the patient immediately, take a photo, hit label it, hit submit. And the very cool thing there is the interaction within Medtech is so fast that it's up there within seconds as a new inbox record. So then if you're, say, doing a dermoscopic picture, and by the way, you can do multiple pictures without having to redo the NHI. So you can take a macro shot of a lesion, then a dermoscopic photo. And the cool thing is it's in an inbox record already with the picture there. So you don't have to click any files to open. It just kind of sits there, and then you can go over the lesion of note with your patient and point out bits you're worried about or why you might want to bring them back and so on. So that's kind of the ease of use, and it's it's good. The other thing that I like about it is, I guess this is an Alex meeting, is I used to use a competitor product, but it was using, like, in the old days, a lot of backdoor access into the Medtech database. So Alex is a modern API, so it's a way that software can talk with software. It means it's secure, means it's supported, means if Medtech changes some stuff around their software, it will keep on working. You won't have this kind of point where, oh God, we've got to talk to the developer because Medtech have changed something, so they need to change something. So I think that security and using approved channels into your database is an important consideration. Anyway, that's all I've got to say. And I will have to pop off pretty soon, I'm afraid. I'd love to stay for the analytics stuff and see what you guys are doing. Maybe I'll jump on the web and look at the webinar later. But as you can see, I'm at home, but I better shoot up to the office pretty shortly.
Yeah, that's okay. Thank you for sharing your experience with QuickShot. So we've actually planned a little hands-on activity so you guys can have a play around with our QuickShot module. So on the screen, you'll see here is a QR code. So if you're on like a laptop or a desktop, you can go ahead and scan that QR code using your phone. It will take you to a login page where you can enter the details below here as well. If you are on a smaller device, you can't scan the QR code. Alex will pop a link into the chat so that you can click that instead. So I'll give you guys a quick moment to get that set up, and then we'll go from there. Cool. So hopefully everyone's in and can see the QuickShot screen. So it should sort of look like this here. You'll see that it's asking for an NHI number. We've just given you guys a, I guess like a test submission or a test patient. So once you enter that NHI, a match will be found as John Smith. So what you guys can do is you can go ahead and take or upload a photo. We do trust that you guys will upload something that is appropriate as well. Then you can either go in and add a description or just toggle that autofill button there just to sort of put the date and time as well. Then you can just submit it. Once you guys have done that, I will hand it over to Daniel and he will show you how that looks inside the Medtech system and how it will appear if you were handling it on, I guess, in your own patient management system as well. While he sets that up, I will just give you guys some time to upload something and see if you guys are successful in doing so. Cool. So hopefully everyone has had a chance to submit something. I'll hand it over to Daniel now, who will show you how those submissions appear in Medtech. You might need to switch screens potentially as he will share his screen instead.
So we'll see here, this is the patient inbox view and inside Medtech. We've got the list of records here. We can see actually these are the ones we've been submitting today. Got a nice little sketch here of a cat. Apologies, I'm not on the larger screen for this. So we can see they come through. They've got the subject that was entered, or if there was no subject entered, it's just come through with the date and time. And it's going straight into that scan folder that's compatible with referral systems that use the Alex API. I'm admiring the different qualities we've got here. It's looking good. Thank you, team.
I'll just make a really quick comment there before I do have to go. One of the things you might have noticed, your eagle-eyed, was that all those pictures went into the scan folder. And you think, why is it going to the scan folder? It used to go into a different folder, But then some of these third-party apps like specialist referrals and so on weren't picking up documents from those folders, but they do pick them up from the scan folder. So if you're wanting to do a referral with these attachments, go straight into most of the referral systems that we use. So that was a nice pickup by the Intellimed team to make sure it worked. And that's my guitar. So anyway, I've got to go. So thank you very much, everyone.
Thank you so much.
Thank you.
Thanks, Dr. Medlicott.
Cool. So you guys may need to switch back to my screen if you've been watching Daniel's. But hopefully that was really straightforward, a really straightforward process for everyone. If it wasn't, definitely please post in the chat sort of what worked for you or what you really liked about QuickShot as well. And so we can sort of go over these in the Q&A session at the end. In the meantime, I will go over a few common mistakes that we hear from clinics using QuickShot and how that we resolve as well. So one of the biggest mistakes that we get is logging in incorrectly. So a lot of the usernames that we provide are always lowercase. So that means the login details are case sensitive. So if you use something like a random capital letter or some punctuation or accidental full stop, you will get an error that you cannot log in. Using the wrong site to log in. When we onboard a new clinic, we always make sure we send out a QuickShot login link. Anything that, I guess, if you modify the link or or it does prompt you with like a different login page, logging in with the user we have provided with you to you will not work as well. This one came up recently, which is using mobile data instead of Wi-Fi. So uploads may fail on mobile data. So that means using Wi-Fi will give you the best result for that as well. Cool. So we're really excited to introduce our analytics module. It's something we've been working on and would love you guys' feedback so we can sort of improve it over time. As we go through the demo later, please feel free to share any questions or ideas or features that you think could help the clinic as well. So essentially, analytics gives you guys a really clean interface, a simple dashboard that allows you to track things like clinic income, unpaid fees, or other key insights. This makes sure that it makes it really fast and allows you guys to make smarter decisions without the hassle. It's also designed to save time on manual reporting. So if you're used to doing things in Excel or other manual tools, it'll be quite helpful for that as well. So again, I will hand it over to Daniel, who you will share his screen and demo analytics for you guys. So again, you may have to switch screens to his one for this one as well.
Just give it a moment to switch over. Just give everyone a moment there to switch over. So the data set we've got here is a synthetic data set, but it's designed to kind of resemble what you'd be seeing coming through for a clinic. The numbers might be a bit whack, but just keep in mind this is synthetic data. So what we've got here is just a general overview, and it's a quick way to see the high-level insights into your clinic. This is just looking at a month-by-month view. So we've got the total revenue, expenses, profit broken down across here. And this is just a quick way you can have a glance, see over time, how am I trending? Am I going up? Am I going down? We've got breakdowns by month. So this lets you compare across different years. You tend to have seasonal differences that influence each month similarly. So it's very helpful to be able to have a look at, for example, in February, how did I do 2022, 2023, 2024, and do an analysis on that. We've got some breakdowns by expenses, and this is looking at the expense categories with the highest change. It's based on standard deviation, and it's essentially seeing what are the most irregular expenses. The ones that are consistent for a long time probably don't need frequent review. But if there's one that's changing quite a bit, that's the one you want to draw your eye in on. We've also just got a simple breakdown of the cost of sales as well, which is one of the expense categories. Our main view here, this is where we have some more drill downs into the data. And this is all about income on this page. So the expense that we saw from here is coming from external systems. So for example, a lot of clinics I know are using Xero. So that's one of the ways you can bring that data in and get it coming through, categorized according to how you've set it up in Xero into this data set. So looking at income, we've got the breakdown, so that's the income, and we've got unpaid fees as well. Some clinics face a lot of those, and it's an important one to keep track of, especially as it starts growing. I know a lot of clinics had trouble with unpaid fees over the period of COVID, and have now been working to try to remedy that situation over the last couple of years. We don't have any capitation provider set up into this one, but once you join into this, you'll better link in some sort of data source for your capitation. And that will show the summaries of how much you're getting from the capitation sources and how much is outgoing through the clawback. Down the bottom here, we have some charts, and that's giving us a breakdown by each month as they go. This is the overall income by that date, by providers. Some providers may trend upwards or downwards. It's quite handy to be able to see which are the highest performing providers, and if there are any that have sudden changes that perhaps you weren't expecting. Sometimes that's due to a lack of charging for extra costs, which I know in some cases can start adding up quite a bit. In the event you have a practice structure that has multiple subclinics, you can split it out by location and also see each individual income stream by location. Different services. So usually for a GP clinic, the key service is consultations. This will be encoded according to your service code structure, but often we see C is the code for this. But we can see essentially the top few services and the income they're providing into the clinic. So for example, flu, ECG, or new patients. And we also have a breakdown by funder, and that helps identify that subsidies matching expectations. Over here, on the left, we've also got an array of filters. So we can filter by date, start date, end date. We can aggregate by month or by year. So we'll see here in our dates. We can also collect this up and look at a very high level view over the years for longer running clinics. We can filter by practice or by location. And we can also filter by individual providers. So if you had this set up in with your PMS, that'll be coming through with your provider names, so you can easily identify them and track individually how each provider is going. Further work we're doing is integrating with payroll systems and rostering systems. And it's designed to help provide inputs and insights into how your rostering is carrying out and whether you need to target your rostering according to changing clinics' needs as some services increase perhaps. Our overall strategy for analytics is on an opt-in basis to set up a number of clinics providing aggregated data for benchmarks. So practices that are interested in that would be able to provide essentially the very high-level stats for their clinic, and then have that aggregated as one combined unit across many practices and see how they're doing against that common benchmark. So once we reach enough practices involved in that, we're looking at rolling that out. We don't want to open it up with too few just to maintain the privacy, but once we have a very large data set in the aggregate, we'll start giving some useful data, and you can see where your practice is tracking across a few metrics compared to the national norm. At this stage, we're looking to increase our group of early adopters, and this group is a fairly high interaction group. So we're trying to find out what practices are looking for, and if you have any desires for what you see in these reports, that early adoption group is the one we're really going to be paying attention to as we develop this further. So if you're quite keen on something like this, we'd love to hear from you and start building up that base and that knowledge of the value that you can get out of this. Thank you.
Sorry,
yeah,
I
there we
am
go.
muted. Cool, sorry. Hopefully we have some good insights from you guys. Or any questions from the chat, we'll jump into the Q&A session. So if there's anything you'd like to ask or anything that you'd like to say, please leave it in the chat and we're happy to answer that for you as well.
So there are a few already in there that have, some of which have been answered by Anthony as the webinar has been progressing. So it may be worthwhile running through some of those if you like. For example, Kay has asked how much it costs. Even just a ballpark number is always it's always good to kind of give an indication and whether or not we've also got somebody asking if it's an alternative to Xero. Do we want to answer those now?
I will leave that to Anthony and Daniel to answer, as they will be able to give a little bit more detail to those. So yeah, Daniel or Anthony, somebody asked, is this an alternate to Xero?
So if I start with the Xero question, this is something to complement Xero. So Xero is something you better feed data into this, but we're also looking to bring in, we'll set it up so it brings in data through Medtech as well. And it gives a slightly more Medtech oriented focus to the data that you're able to read in through there.
Okay, I appreciate that this may be slightly different for each practice in terms of how the setup might be, but can you give some indicative costs for both the analytics platform as well as QuickShot for practices, to even just a ballpark to give an idea?
So in terms of QuickShot, it's depending on number of users. So basically, the basic model is each user is what's it, $5 excluding GST per month. But there was also a one-off implementation cost as well. So, yeah, we'll obviously dictate that depending on number of users within the clinic as well. So.
Okay, we've also got does it play nicely with GP to GP and HealthLink? I'm assuming this is referring to QuickShot.
Yeah. So the great thing with, sorry, would you like to? Yeah. Okay. So the great thing with the new Alex update supporting that scan folder is, as well as we're working with those referral systems, it works just as ordinarily as your files would, ordinary documents coming through Medtech. So GP to GP, HealthLink, business as usual.
Okay. And we've got, QuickShot, do the photos uploaded to the PMS fit the right size and parameters required for referrals? It was said they could be attached to referrals from the inbox, but this is about the parameters of the file, as once it's in the PMS, it cannot be edited.
Yeah, so we have a few controls in terms of the incoming files, and our approach within QuickShot itself is scaling that file down to a size that can be accepted by the Alex API that is then suitable.
Okay. If the data dependency, I believe this one's pertaining to the analytics platform. If the data dependency is a Medtech data feed, what is the value add for a GP practice except the presentation part, in parentheses, charts?
Is that a Eugene question?
You can probably answer. So the key point of this is a central place for this kind of data to come in. And as a very Medtech oriented and therefore practice oriented structure to the data, we're expanding some subviews below this such that you can drill down into it. But the key focus for this is giving further insight into the details you can see within Medtech that aren't normally coming through in a system like Xero. But it still works with Xero to achieve this if that's the accounting software you're using.
Okay. Did we have any other questions at the moment? And of course, just if I don't know if anybody on the line is like me and has a tendency to think of all the questions coming into your brain when you're trying to get to sleep at 2 a.m. or something like that. So of course, any questions that may crop up after the webinar, whether it's tomorrow or it's next year, please never hesitate to get in touch with either us here at Medtech or the Houston Intellimed team, and we will be happy to help however we possibly can. With that in mind, just in case we are waiting on any other questions, what I might go ahead and do is I'll just share my screen very quickly, just to, if you can all see that. I'm not sure if you can.
No.
There we go. It should be. There we go. So if you can see that, can everybody see that okay? We've got on our screen, we've got an email address here, activatealex@medtechglobal.com. If ever you want to connect to Houston, or if you have any questions about anybody you are connected, any of our partners that you are connected to or wish to connect to, that is the email address to contact. And I promise, I know it looks like a shared address. We are responding to that quite regularly. In fact, it comes directly to my phone, so you might get an answer sooner than you think in the middle of the night if you get a question. But we also have up here a QR code that points to all of our partners. So if you do have any questions at all about any of our partners, that's a good start point. All right. Okay. All right, unless we have any other questions. And of course, again, please feel free to reach out if you do have any questions that crop up after the fact. If you don't have any more at the moment, I want to thank everybody in the Houston team for joining us today, as well as Dr. Medlicott for taking the time to walk us through both products today, as well as answer questions. And I want to thank everybody who's on the line for taking the time to attend, because time is very precious in primary care, and so we do really appreciate you taking the time out of your day, very, very busy schedules, to spend with us. As I mentioned earlier in the session, if you have any colleagues or know anybody at all who was really keen to attend the webinar, but for any reason couldn't, be it they were seeing patients or were otherwise busy, please feel free to reach out to the email address on the screen at the moment, and we will be very happy to send along the copy of the webinar. It looks like we do have one more question that's just come through. With providers taking multiple photos, does it clog up Medtech? Anthony, that might be one for you.
We haven't had an issue so far of people saying, multiple people take at the same time because of obviously for Alex, so no.
All right. As mentioned, I will be passing earlier in the session, I will be passing all of these questions on to the team at Intellimed. So they'll have a copy of all of those and can follow up if need be. And then, of course, please feel free to reach out to either us here at Medtech or the Intellimed team for any extra questions that might crop up. Otherwise, thank you so much for taking the time to spend with us today. And I hope you guys, I know we're coming to the end of Thursday, so I'm very tempted to say have a great weekend, but have a great rest of your week as well. And thank you so much.
Yeah, thank you, Alex. Yeah.
Thank you.
Thank you, Alex.